Hello, my dog lovers. Hi. Today, I'd like to talk to you about joint disease and senior dogs. I often hear dog lovers saying that they've been given the recommendation of taking it slower with their older dogs because, they're arthritic and they're in pain or discomfort and that they should not exercise as much. But guess what happens to dogs or people who do not exercise? They deteriorate even further. So my experience, because I am considered an old dog now, I'm 60. My experience is that the more I exercise, the less discomfort I have. And I actually have never felt better, to be honest, than now, which is a little bit of a surprise. So I would like to actually share with you what I do and what I also recommend for my patients, for dogs. It is super important for senior dogs to maintain their muscles and also maintain the strength of your dog's tendons and connective tissue and fascia. Because if the connective tissue and the muscles are strong, there's going to be less laxity or movement within the joint that is undesired. So obviously this is the right movement, but if I have two loose joints and don't have enough muscle mass, then my shoulders and my back and everything will start going and will go through inflammatory stages and injuries and so on. So it's super important for us to exercise our dogs. Now, there are several different courses and recommendations by rehabilitation specialists and so on. So I'm not going to go into the detail of that. But what I do want to say is that slowing down with your dog and not exercising is actually counterproductive. So what you want to do is to maintain the muscle mass, make sure that you do enough for your dog to keep strength, but you don't overdo it and you don't go crazy with your dog retrieving a ball or jumping high up and so on, because that's more likely to cause some injuries. So uphill walking, longer hikes, that all is good as long as your dog doesn't get injured. It may happen sometimes that your dog will overdo it and then you kind of step back a little bit. You go, okay, I walked for 3 hours or 2 hours. Now I'm going to do an hour and a half, give it a rest a little bit and then do a little bit less, maybe 25% less. But also building the strength. So it doesn't necessarily mean when you scale back that you don't need to go back up, because that's how we grow our muscles and that's how we maintain our strength. When it comes to joints and mobility, I'm a firm believer that maintaining the joints through healthy nutrition, whether it's omega-3 fatty acids or joint and mobility support, such as joint powder and joint butter, are super important in providing the right nutrients, but also reducing the inflammation of the joints and tissue. Another one is laser therapy that I really appreciate. And Dr. Lori McCauley has taught me how important it is. Not only it's good for reducing inflammation and discomfort, it actually improves the production of stem cells that helps to heal tissue, joints, muscles, and so on. What else? Chiropractics, physiotherapy, again, more targeted strengthening of different parts of the body. I love working with physical therapists. I like working with rehabilitation people and massage therapists when it comes to the animal world, but also the human world. So just to repeat, not only exercise, rehabilitation, and laser, but also the right supplements. Omega-3 fatty acids, such as Feel Good Omega, and joint powder and joint butter are my supplements to go to when it comes to mobility and also recovery from injuries and any incidents that may happen as your dog ages. But then there are also the essential building blocks, such as vitamins and minerals and also probiotics, because it all kind of connects together. Probiotics, for example, are super important for the function of the immune system. And we know that the immune system affects healing, but it also affects the joints. Many dogs, when they start having inflammation, will actually start generating immune complexes in the joints and in the tissue, which leads to more inflammation. It's kind of a vicious circle. What I do not like for inflammation and injuries are NSAIDs, non-steroidal anti-inflammatory drugs, mainly because they kind of give us an illusion that everything is fine and our dogs will start moving, but the healing process slows down and the regeneration slows down while our dogs don't feel the pain. So there's more damage going on. So if you do want to use NSAIDs, do not use them for long term. Personally, I almost never prescribe them and I would never give them to my dog. So that's something that may be slightly different from conventional medicine. I'm not necessarily saying that conventional medicine is not good for our dogs. It can be actually very helpful and very useful. But when it comes to drugs that suppress the natural healing response of the body, I do not really like that as much. So That's all about joints for today and chronic mobility issues and discomfort. I hope that this information will be helpful. If you have any questions, you can always contact me through petertobias.com. And don't forget to subscribe, because the more people subscribe to our channel, the more people will be able to help. And give your dog a hug for me. Thank you so much. Take care.